Good afternoon, everybody. This is County Executive Pat Ryan. It is Thursday, May 14th, for those of you that have lost all track of day and time and month, if you're anything like me. I hope you are hanging in there and doing well. We are definitely doing that here. Thanks for joining us, and we are going to have some updates on the public health situation, as well as talk about where we're at in terms of our recovery and reopening efforts, and then we'll wrap it up and get everybody on with the business of the day. So starting with the numbers and the data, we are continuing to see an increase in total number of positives, but encouraged by the fact that that's growing at a slower and slower rate. So we are at 1,542 total positive tests. Our testing number is way up. We've now tested 9,464. So that gives us a percentage of positive rate of 16.3%, which is, again, we continue to see that go down. That is a very positive sign that testing is going up and positives are going down, and so that percentage continues to decrease. We unfortunately have now 64 fatalities of Ulster County residents. We're continuing to unfortunately see that and to see the virus take its toll, and it's hard every day or every other day to continue to have to share that, but I think it's important that we remember the seriousness of this and the impact on our community members and their families and loved ones. So we send our best wishes and our condolences to them. We have had 753 residents recovered now, which continues to go up. And if you look at our projections out 10 days, we continue to track towards best case, which would have us at around 1,600 to 1,700 total positive cases. In terms of the hospitalization numbers, the trend line here is very, very good. This is exactly what we want to see, a clear downward trend over time. We are at 11 hospitalized in Ulster County right now. And again, that continues to go down, and we project it will continue to decline. And that remains one of the most encouraging points in that regard. In terms of active cases, so I often talk about the total. The first slide talks about our total number of positive cases. That is a cumulative number, meaning from the very beginning, our first case on March 8th, that 1,542 is everybody that's ever tested positive. However, as we know, hundreds have recovered. So there are only 731 active cases right now of COVID-19 in Ulster County. So that's what you see on this graph here, and that number does continue to decline. We had a significant decline just in the last 24 hours, so that is good news, and we anticipate that that will continue in the near future as well. And we'll talk more about the dashboard in a second, but if you go on our Ulster County COVID-19 dashboard, you'll see that we've updated that significantly and added several new metrics so that you can have a more data-driven sense of what's happening, how things are trending. And that active cases number is on there now that you can see. And of course, we want to continue to see that go down. And that's a better representation of where we're at right now in the county, and that's 731. Finally, I want to update the graph that we started showing about a week ago, which is the daily number of new positives. So what this means is every day we're testing some number of people, and most of them are coming back negative. About 85, 84% are negative, but some number are positive. And that number of new positives each day continues. You can see a very steep downward curve really since mid-April. And that is another positive indicator that we are headed in the right direction and that we're on the downslope of the worst of COVID-19 in the county. That also continues to trend down. So all good news in terms of what the data is showing and where we're at there. Finally, in terms of hospital capacity, we are, as I said, at 11 hospital beds in use right now in the county for COVID patients. And for the first time in over 2 months, we have 0 patients in the ICU and on ventilators. That is a very, very good thing to see. We hope that that remains to be the case. We still have 11 that are sick enough that they need to be in the hospital, and we are with them as they fight this with their families. But to see 0 people in ICU beds or ventilators is very good news. So those are really the key updates on the public health dynamics of COVID-19 in the county. We're doing this delicate dance where we have to continue to keep our eye on the ball in terms of the public health response, to monitor those metrics and to see how the disease is spreading and hopefully declining. And at the same time, we started several weeks ago planning and thinking about how we slowly unwind and slowly get things going again in Ulster County. And the best analogy that I've been able to think about for this is, you get in your car, and for those of you that still drive a stick shift car, like I do, at least with one of our cars, you'll get this idea that once we decide to open, we're going to start in first gear. We are not going to immediately try to go 0 to 60 or 0 to 100. We're going to very slowly, deliberately start in first gear, see how that goes before we make any adjustments or any changes, and we'll slowly work our way up, assuming that we see the virus remain under control. So that's really the mindset that we have, and getting that balance right, with the overall goal always has to be health and safety and protecting the lives of our residents, and that has not changed and will not change at any point from my perspective and from our perspective. So as we think about that in that context, what does our reopening look like? We've talked about these 3 R's: recover, reopen, and realign. So where are we in our planning on that? How are we doing in terms of each of those lines of effort? I wanted to share some updates there as well. So I talked about this earlier. One of the goals in everything we do is to be transparent with you all. I believe and trust that if we give our residents the information, they will make the right decisions along with the community to keep us all safe. And that starts with having good, accurate data. So we did a significant update to our COVID-19 dashboard. One of the big things we added for the first time yesterday was a view of the 7 metrics that New York State, that Governor Cuomo has outlined for when we begin the reopening, when we begin phase 1 of what will be a 4-phase reopening process. So there are 7 metrics here. I'm not going to go really, really in depth because you'd probably potentially fall asleep. But all the detailed breakdown of these metrics is on our website as well as the New York State website. There are really 3 categories of metrics that we care about. The first is about how serious and how bad is the spread of COVID-19. So we're looking at number of people in the hospital, number of deaths, number of new hospitalizations in the county and in the region. So that's one area. The second area is about hospital capacity. So we want to be ready that in the case that we reopen and things get worse, that we have extra capacity in our hospitals, hospital beds and ICU beds. So that's really what those metrics are about. Worst case, we know we need to be ready if there is a resurgence. And then finally, the third category is to prevent that resurgence, to immediately identify, detect, and contain and isolate if there is a small reemergence of COVID as we begin to open things up slowly and carefully. So that's about diagnostic testing capacity and tracing capacity. So those are, again, really the 3 categories of how Governor Cuomo and the state, as well as us here in the county, are thinking about this. And I think it's a really well thought out model and way to think about when we can safely and responsibly get things going again. So we're laying out on our dashboard where Ulster County is at as a county, as well as where our region is at, which includes 7 counties. And I absolutely agree with Governor Cuomo that this has to be a regional approach, that we can't just operate on our own given the interconnectedness between Ulster and Dutchess and Ulster and Orange and Ulster and other surrounding counties, that we want to have a consistent approach to this and that a regional approach makes sense. So we will continue to update this dashboard as well as the other metrics we've added on the website, which includes active cases, more information on testing, daily testing numbers. So for those of you data nerds out there like myself, you can go to our webpage. Again, it's ulstercountyny.gov, and you can see all of these metrics and data there and have the same information that we have as we're wrestling with these decisions. As we announced that dashboard and talked about those metrics and showed both where Ulster County is at and the Mid-Hudson region, I get that this is, it feels like I'm back in school in terms of the number of metrics and data points and measures, and it can be confusing. And the last thing we want is for anyone to be confused about where we're at and where we're going. So I do want to just be very clear and explicit in terms of where Ulster County and the region, both Ulster County and the Mid-Hudson region, which we are a member of, will remain on pause and will not move into phase 1 reopening tomorrow, May 15th. Now, I know that other regions in New York State are headed that way. I believe it's 4 now are, but I just want to be very clear, we are not there yet. And we will continue to do all the work to get ready. We're doing that planning. We're monitoring the health situation. But I just want to make that very clear. And in addition, I want to emphasize that even when we do reopen, whenever that comes in the coming days or weeks, we still absolutely need and expect that individuals will maintain social distancing, that they will be wearing masks, and that we'll need to operate in a very different way. We cannot just immediately, as I said, go 0 to 60 here. We have to do it slowly and carefully and be very, very thoughtful about how we're going to progress. But at the same time, I'm mindful that we can't stay in this situation we're in now forever with our economy completely shut down and just tremendous pressure building on our residents, our businesses, our farms, our not-for-profits. So we are right at that transition point, and I know change and transition are uncomfortable, but just trust that we are very carefully and deliberately thinking about this, and we'll always do everything with the #1 priority of keeping you all safe and healthy. A few other updates on other parts of our recovery and reopening and ultimately our economic resilience plan that I wanted to share. That I'm excited to share today. We talked last week about our Ulster County Recovery Task Force, and what this is really about is meeting that most urgent need of our community, or the most urgent needs of our community, due to the devastation of COVID. Not just the health devastation, but the impact on all of the supports and services and needs that we have, from addiction and recovery to mental health to housing to food and all these other critical things that we often took for granted and that are at even greater risk now. So I've been convening each week our recovery task force with community leaders from all the different service providers in our county, social service providers, mental health providers, educators, and school leaders, to talk about and think about these needs and make sure we're really understanding what those needs are at a granular, data-driven level. One of the most existential needs that has consistently come up is about housing. At the end of the day, having food, having shelter are the most necessary things for our community, for just the baseline of security for our residents and for our families. And even before COVID, we knew that many in our community were struggling to find housing that they could afford, despite working 1, 2, multiple jobs. We had 4 in 10 families living paycheck to paycheck before COVID. We had over 60% of our residents beyond the affordability threshold for housing, meaning they're paying way too much of their limited income just to be able to pay rent or to pay their mortgage. So this was, again, already a problem where folks were struggling to have a decent place to live and a roof over their head for them and their family. And then you add COVID to that, and it just absolutely exacerbates and builds on that problem. One of the things that I've been hearing stories about are the frontline workers who we thank every day at the end of our briefing, who I know you all are thanking in every and any way you can. Those same frontline workers, our grocery store workers, our postal folks and delivery workers, of course, our healthcare workers, so many others that are taking care of us, we're not making sure that they are able to have decent housing to live in. At the end of the day, we have frontline workers working full-time to serve and protect us, and they should be able to afford decent housing in our community here, and that is not the case, and we know that's not the case, and that is just absolutely unacceptable. So we are going to, as part of our recovery, take action to address this problem and move quickly and urgently, and there will be more on this to come, but some initial steps that we are taking. Number one, we're calling out this problem, which is always the first step, and recognizing that we have to do more than just thank our frontline workers with words. We have to make sure that we are taking care of them in the same way that they've been taking care of us and putting themselves out there for us. And that starts with ensuring decent housing and options for them here in Ulster County. So one is identify the problem and build support and consensus behind this, which we're working on. Two, this is going to be an expansive effort to make sure that all of our residents, our frontline workers, and everyone can afford a decent place to live. And to do that correctly, we have to have all of our partners lined up and on deck. So I've had very encouraging conversations with members of our Ulster County legislature about this at their next legislative session, which I think will be virtual probably, but that you can tune into. They will be talking about and considering a resolution to this effect, and so I'm very excited to partner with them on this series of initiatives to ultimately ensure we meet this urgent need for housing in Ulster County. A lot of this it's pretty simple when you boil it all down. The big problem is we just actually don't have enough inventory, or that's one of the biggest problems. Prices go up, as we all remember from our basic economic classes. Prices go up when demand exceeds supply, and that's really what we had even before COVID here, and that's going to get even more acute as people have less income. So we need to build more housing inventory. We're going to be looking at options as a county to identify county property that we might be able to use and leverage to build more housing options for our frontline workers, for all of our workers, so that those that are putting in a full day's work and doing everything they're asked can afford a decent place to live. So you'll hear more on this from us in a series of initiatives coming out, but I want to make clear that this is going to be one of our and my top priorities, driving our recovery efforts, ensuring, again, that those, like our frontline workers that are putting it on the line for us, that we're going to be there for them to help them have a roof over their head. And we'll be rolling out more of that in the coming days and weeks. Finally, just to wrap it up, I want to keep everybody updated on Project Resilience, which continues to progress. We have now, between prepared meals and grocery meals, we're approaching 200,000 meals delivered to thousands of households all across Ulster County. This is due mostly in part to three things. One, very generous donations and support from you all, from community leaders and other philanthropic groups into our community fund. Two, to an army of volunteers that are part of 16 different regional teams, mostly led by your town supervisors, your mayors, your local leaders on the ground making this happen. I know several of our elected leaders at the town and city level are themselves out there delivering these meals, which is absolutely incredible and absolutely what government should be doing at this time of need. And finally, it's due to over 160 restaurants that have partnered and have been preparing these hundreds of thousands of meals at cost to make sure we could get this great food out to those that are homebound, those that can't afford meals or can't prepare those meals. So again, I'm so proud of what we've done with Project Resilience. We're going to keep this going as long as we can. As you can probably see if you're tracking the numbers, we're shifting to more and more grocery deliveries so that with the limited funds that we do have, we're able to make them last as long as we can. And so, we will be shifting more and more to that, but we are here to continue to meet that food need. And if you have it, you can always reach out to us. You can reach out on our website, which is ulstercountyny.gov. You can call our COVID-19 hotline, which can get you connected with what you need. That number is 845-443-8888, 845-443-8888. And that's for really anything you need related to COVID. And then just to wrap it up, I know we talked about this, but I always think it's important that we end by just taking a minute and appreciating how our community has stepped up and how many members of our community have stepped up. I want to thank all of those that are putting themselves at risk now, from our healthcare workers to teachers who may not be in as much physical harm, but who I know are making it work for remote learning in a way that they've never had to do, our mail carriers, delivery workers, our pharmacy workers, public transit workers, all the parents out there who are grappling, like Rebecca and I are, with how to educate and take care of your children while either working or finding work or making it work, basically. So thank you to all of you. Thank you to those frontline workers. Just know that we are here and we see what you're doing. We have your back. If you have need, you can reach out, and we're going to do everything we can to take care of you and to take care of each other. I thank everybody for tuning in and hanging in there. Please keep hanging in there. I hope we continue to have good news. Our next formal briefing will be on Tuesday at 2 p.m. But of course, you can always check our webpage. You can check the dashboard. That's updated every day. You can check our social media, Facebook, Twitter, Instagram, all those fun things. And you can always just also pick up the phone and call us. We'll end by putting that number back up again to remind you of those resources. Thank you to Radio Kingston and the Radio Kingston team. Thank you to Diane and Roxanne, who are fantastic and helping make sure everyone can tune in and follow what's happening, and Manuel for translating to Spanish language. We will see you on Tuesday. Stay safe and healthy, and take care.